short term. But certainly used as an illicit drug of abuse and has many different names: ecstasy, ice, crystal, MDA, Eve, all just different forms depending on what they add in the chemical lab. So methamphetamine exposure. So the exposure outcomes are pretty uncertain, again, because it's often multifactorial or polypharmacy. They can have prematurity, IUGR possibly as high as a 2-fold increase. There is a questionable risk of congenital anomalies. They can have some poor school performance, behavior problems, increased emotional reactivity, anxiety and depression, ADHD, motor and mental impairment in the first year of life, with heavy use. I tried to find out their definition of heavy use because I'm always interested to hear what their definition of heavy is, because I'm not a heavy methamphetamine user, I'm just a light user. I always find that interesting. But anyway, so withdrawal is unclear. There are reported cases of babies having a shrill cry, being irritable, being sweaty and sneezing. And then on some neuroimaging studies where they looked at pictures of the brain and so forth, there was some structural and metabolic brain abnormalities. So opioids. So we all remember the Wizard of Oz and the field of poppies, and that's what opioids are. So they're a natural and man-made substance resembling morphine, and it's made from opium and from a poppy plant. Examples include, these names will probably sound familiar: codeine, heroin, methadone, Percocet, Vicodin, Lortab, oxycodone. Prescription pain medication abuse is on the rise. I think a lot of that is going on here. It is a little difficult to try to tailor a topic for people who are all over the whole country. So I know some of the stuff that I'm going to talk about is primarily in Florida, but